Facing a medical procedure can bring up many questions and feelings of uncertainty, and this is completely normal. My goal here is to walk you through what a cystoscopy is, step by step in a calm and clear way. A cystoscopy, منظار المثانة, cystoscopy, is a common and very helpful medical test. It allows your doctor to look directly inside your bladder. This is done using a special instrument called a cystoscope. Think of it as a very thin, flexible tube that has a tiny camera and a light on its end. This slender scope gives your doctor a clear, detailed view of the inner lining of your bladder and urethra. The main purpose of a cystoscopy is to help your doctor understand what is happening inside your urinary system. It is a diagnostic tool, which means it helps find the cause of certain symptoms: blood in your urine, frequent urinary tract infections, difficulty urinating. By looking inside, your doctor can identify potential issues, such as inflammation, bladder stones, blockages, unusual growths, sometimes called tumors, tumors. The procedure is designed to be as comfortable as possible. It provides vital information that helps your care team create the best treatment plan specifically for you. This guide is here to answer your questions and reduce any anxiety you might have. We will go through the entire process, from preparing for the test to what happens afterward. Your doctor might suggest a cystoscopy for several important reasons, all related to your urinary health. One of the most common reasons is the presence of blood in the urine, a condition known as hematuria, hematuria. Sometimes this blood is visible to you, and other times it is only found during a lab test. A cystoscopy allows the doctor to search for the source of the bleeding directly, which could be anything from a simple infection to a bladder stone or a small growth. It is the most reliable way to investigate the bladder lining for any abnormalities that could be causing this symptom. Another frequent reason for this procedure is to investigate chronic or recurrent urinary tract infections, UTIs. If you find yourself dealing with infections over and over again, there might be an underlying structural reason. For example, there could be a blockage or a pocket in the bladder where bacteria can hide and multiply. A cystoscopy can help your doctor identify these issues, which might not be visible on an X-ray or ultrasound. The test can also be used to evaluate symptoms like painful urination, a constant urge to urinate, or an inability to fully empty your bladder. Doctors also use cystoscopy to monitor patients who have a history of bladder conditions. If you have previously been treated for bladder cancer, for instance, your doctor will likely schedule regular cystoscopies. These follow-up exams are crucial for checking that the area has healed properly and to ensure that no new growths have appeared. Proper preparation is an important step in ensuring your cystoscopy goes smoothly and safely. Your medical team will provide you with specific instructions. It is very important to follow them closely. You will likely meet with a nurse or another care team member before your procedure. During this meeting, they will review your medical history and ask about any medications you are taking. Be sure to tell them everything. Over-the-counter drugs, vitamins, supplements. This information is vital for your safety. One key topic is whether you take blood-thinning medications, aspirin, warfarin, clopidogrel. These can increase bleeding risk. Your doctor may ask you to stop them for a few days before the cystoscopy. Never stop prescribed medication without first talking to your doctor. They will give precise instructions on when to stop and when you can safely resume them. This is a critical pre-procedure safety step. You will also receive instructions about eating and drinking. This is called fasting. If you have general anesthesia, you will be told not to eat or drink for several hours, typically starting at midnight before the procedure. This keeps your stomach empty to prevent complications under anesthesia. If you have local anesthesia, if you have spinal anesthesia, fasting rules may differ. Always follow your hospital or clinic's specific guidance. Write down questions and bring them with you. Arrange for someone to drive you home on the day of the procedure. You may feel tired or groggy afterward, so don't drive. Wear comfortable, loose-fitting clothing. When you arrive, the nursing staff will greet you, confirm your identity, and help you get ready. They are there to make you feel comfortable and safe. Asking questions is good. The team wants you calm and informed before your test. There will be no scary or graphic footage discussed, only clear explanations. We want you to feel informed, prepared, and reassured. To ensure you are comfortable and do not feel pain during the cystoscopy and any related treatment, you will be given anesthesia. The type of anesthesia used will depend on the complexity of the procedure, your overall health, your doctor's recommendation. The two most common types for this procedure are spinal anesthesia, تخدير فوق الجافية, spinal anesthesia, general anesthesia, تخدير عام, general anesthesia. Your anesthesiologist will discuss the best option for you, explaining the benefits and what you can expect to feel. Their top priority is your safety and comfort throughout the entire experience. Spinal anesthesia, تخدير فوق الجافية, spinal anesthesia, is a type of regional anesthesia. It numbs a specific region of your body while you remain awake and aware. For this procedure, a very fine needle is used to inject numbing medication into the fluid surrounding your spinal cord in your lower back. This blocks all feeling from the waist down, so you will not feel any pain from the procedure. You might feel a sense of pressure or movement, but it should not be painful. Many patients prefer this option as it avoids the grogginess associated with general anesthesia and often has a quicker initial recovery. General anesthesia, تخدير عام, general anesthesia, puts you into a deep sleep for the entire duration of the procedure. The medication is usually given through an intravenous line in your arm. You will be completely unaware of the surgery and will have no memory of it afterward. Your breathing, heart rate, and blood pressure will be closely monitored by the anesthesia team from start to finish. A breathing tube may be placed after you are asleep to help you breathe safely. When the procedure is over, the medication is stopped, and you will slowly and gently wake up in the recovery room. The choice between spinal and general anesthesia will be made with your input. The anesthesia team will review your medical history and talk with you about your preferences and any concerns you may have. Once you are in the procedure room and the anesthesia has taken effect, the cystoscopy, خطوات العملية, the step-by-step procedure, will begin. You will be positioned comfortably on a special table, usually lying on your back with your legs supported. The medical team will then carefully clean the area around your urethra with an antiseptic solution. Sterile drapes will be placed over you to keep the area clean and protected throughout the procedure. Your comfort and safety are the team's primary focus. Next, the doctor will gently insert the cystoscope, منظار المثانة, cystoscope, into your urethra. The cystoscope is a very thin, flexible tube designed to navigate the natural curves of the urethra with minimal discomfort. The tip of the scope is lubricated with a gel to help it slide in smoothly. As the scope moves through the urethra and into the bladder, the tiny camera on its end starts sending live video images to a large monitor in the room. This allows the doctor to see the lining of your urinary tract in high definition. To get the best possible view, the doctor will slowly fill your bladder with a sterile saltwater solution, also known as saline. This gently expands the bladder walls, smoothing out any folds and making it much easier to see the entire surface. As the bladder fills, you might feel a sensation of fullness or an urge to urinate. This is a completely normal and expected feeling. The doctor will then carefully and methodically inspect every part of your bladder lining, looking for any signs of redness, inflammation, stones, or abnormal growths. The entire inspection is usually quite quick. The doctor may take pictures or record short videos of any areas of interest to add to your medical record. If everything looks normal, the procedure is complete. The saline is drained from your bladder, and the cystoscope is gently removed. If the doctor finds a small abnormality, like a small stone or a suspicious-looking growth, they may decide to proceed with a biopsy or removal during the same session. This is something they would have discussed with you as a possibility before the procedure began. If during the cystoscopy your doctor discovers a small growth or tumor on the wall of your bladder, they may proceed with a procedure to remove it. This procedure is called a transurethral resection of bladder tumor, or TURBT. The name sounds complex, but the process is straightforward. It is performed using a special instrument passed through the same channel as the cystoscope, so no external incisions are needed. This lets the surgeon find and treat the issue in a single session. The removal tool is a resectoscope with a very thin wire loop on its end, the electrical loop. A safe, low-voltage current passes through the loop, allowing it to act like a precise surgical knife. The surgeon guides the loop to the base of the tumor and shaves the abnormal tissue away from the bladder wall, layer by layer. The electricity also seals small blood vessels, which minimizes bleeding. The goal is to remove the entire visible tumor while preserving as much healthy bladder tissue as possible. Once the growth is removed, the tissue pieces are collected and flushed out of the bladder. Those samples are sent to a pathology laboratory. In the lab, a specialist examines the cells under a microscope. This analysis is crucial. It determines if the growth is cancerous or benign. If it is cancer, the report gives information about its type and how deeply it has grown into the bladder wall. After removal, the surgeon inspects the area again to ensure no visible abnormal tissue remains and that there's no significant bleeding. In some cases, the surgeon may give a single dose of chemotherapy directly into the bladder right after resection. This aims to destroy remaining cancer cells and reduce the chance of recurrence. The entire TURBT is done with care and precision while you are comfortably asleep or numb from anesthesia. Once your cystoscopy or TURBT is finished, your journey to recovery begins. You will be moved from the procedure room to a dedicated recovery area. Here, a team of nurses will closely monitor you as the anesthesia starts to wear off. They will check your vital signs such as your heart rate, blood pressure, and breathing to make sure you are waking up safely and comfortably. They will also manage any discomfort you might have. It is common to feel a bit groggy or tired, especially after general anesthesia. This feeling will gradually fade over the next few hours. In many cases, especially after a TURBT, a thin, flexible tube called a urinary catheter may be placed in your bladder before you wake up. This tube drains urine from your bladder into a collection bag. It allows the bladder to rest and heal without being stretched. The catheter can also help the medical team monitor for bleeding. Seeing pink or light red colored urine in the bag for the first day or two is normal. The nursing staff will show you how to manage the catheter if you need to go home with it, though it is often removed before you leave the hospital. Hydration is a key part of your recovery. The nurses will encourage you to start drinking fluids as soon as you are able. Drinking plenty of water is very important because it helps to flush out your bladder, dilute your urine, and reduce the risk of infection. It also helps clear out any remaining blood from your system. You may be advised to avoid caffeine and alcohol for a few days, as these can sometimes irritate the bladder. You may also feel some mild cramping or a burning sensation when you urinate for the first day or two. This is common and should improve quickly. Before you go home, your doctor or nurse will give you specific instructions for your care. This will include advice on rest, activity, and pain management. You will likely be told to take it easy for a day or two and to avoid any heavy lifting or strenuous exercise for about a week. Following these instructions carefully will help ensure you have a smooth and speedy recovery. It is completely natural to have questions and concerns before and after a medical procedure. Let's address some of the most common ones that patients have about cystoscopy. One of the biggest questions is, will it hurt? The anesthesia is specifically designed to prevent you from feeling pain during the procedure. If you have spinal anesthesia, you may feel some pressure, but not sharpness. If you have general anesthesia, you will be asleep and feel nothing. Afterward, it is common to have some mild discomfort. A common example is a stinging sensation when you urinate. This is usually temporary and can be managed with mild pain relievers. Another common question is, how long will the recovery take? For a simple diagnostic cystoscopy, recovery is very quick. Most people feel back to normal within a day. If you had a TURBT to remove a tumor, the recovery will take a bit longer. Most patients can go home the same day. Some may go home after one night in the hospital. You will likely be advised to rest for a couple of days. You should avoid strenuous activity for about a week to allow your bladder to heal properly. Many patients wonder, will I need a catheter? A catheter is not always necessary for a simple cystoscopy. It is very common after a TURBT. The catheter helps your bladder heal by keeping it empty and allowing staff to monitor urine. If you do need one, it's usually only for a short period, often a day or two. Nursing staff will teach you how to care for it. They will make the process as simple and comfortable as possible. Finally, people often ask, when can I go back to work? It depends on the type of work and the extent of your procedure. Desk job plus simple cystoscopy, where you might return the next day. TURBT or physically demanding work, win a few days to a week off. Listen to your body and don't rush your recovery. Your doctor will give a recommendation to help you decide. Your doctor will schedule a follow-up appointment to discuss the findings with you. If a tissue sample was taken during a biopsy TURBT, this appointment is when you will go over the pathology report. This pathology report will guide the next steps in your treatment plan. You might need additional imaging scans, like a CT scan MRI. It is common to have follow-up cystoscopies scheduled at regular intervals. Sorry the sentience montabert spitsunter juridsteed, sorry and derisil sol engagement sorry analysis of your bladder and check for any new changes. This surveillance is a key part of managing bladder health for the long term and a standard of high-quality care. Follow instructions from your care team about rest, hydration, activity. While most people recover quickly, do not hesitate to reach out if you have concerns. You should call your doctor's office if you develop high fever, severe pain not controlled by your medication, heavy bleeding with clots in your urine, unable to pass urine at all. Your cystoscopy is an important step on your path toward better health. After the procedure, the journey continues with follow-up care. Your doctor will explain the results in clear, simple terms and answer any questions you have. Depending on the results, your doctor may recommend further tests or treatments. A cystoscopy can feel like a big event, but it is very common. It is a safe procedure. It is a valuable procedure. It provides crucial information. It empowers you and your doctor to make the best decisions for your health. By taking this step, you are being proactive and taking control of your well-being. The medical team's goal is to keep you safe, comfortable, and informed every step of the way. Trust in their expertise. Ask questions freely. This procedure is a positive move toward diagnosis, treatment, peace of mind. Remember, knowing what to expect is a powerful way to feel more in control of your health journey. Softly. You're not alone. Your care team is here to help, every step of the way.